recognized.
Mr. Speaker, we aren't here to debate the Republican health care repeal plan. We aren't here to debate that because Republican leadership and the White House are huddled behind closed doors as we speak, making deals that will have very real, very serious, very dangerous consequences for millions and millions and millions of Americans. Instead, we're here to debate a martial law rule that will allow Republicans to rush their bill with its brand new backroom deals to the floor today without any proper deliberation. As a matter of fact, it would let them rush any bill to the floor today or any day through Monday. It's a blanket martial law rule that lasts past the weekend, not specific to their health care bill and not even specific to the topic of health care. What other bills could they be contemplating considering? We saw the Buffalo bribe is already in the manager's amendment, but this rule lets them bring up any other bill before the public has a chance to even know what it is. Maybe something on the Russia investigation, perhaps. I've seen a lot of news on that lately. Or maybe we'll give President Trump's friend Putin a congressional medal. It's the least the Republicans could do after his help with the election. But let's talk about what we have learned so far in the press. We first learned from news reports last night that Republicans were considering changes to the bill that would kill the essential health benefits in current law. Now let me say that again, essential, as in absolutely necessary, extremely important, as defined by the dictionary. And sure enough, we reported out this martial law rule in the dark of night, which will allow Republicans to bring the new and unimproved version of the bill, again now with even more backroom deals, to the Rules Committee later today or in the dead of night and take it straight to the floor. Now apparently, there's no time to even have it sit for one day so that members can read it, let alone get an analysis from the nonpartisan experts at CBO. Are they hoping that if they move quickly enough, no one will figure out what they're up to? Well, let me lay it out for everybody. Essential health benefits require insurance plans to cover basic essential benefits such as emergency services, maternity care, mental health care and substance abuse treatment, pediatric services, and prescription drugs. Now, the New York Times this morning pointed out that this late-breaking Republican proposal could lead to plans that cover aromatherapy, but not chemotherapy. I mean, really? Are Republicans seriously contemplating making a change this massive without hearings, without a markup, no CBO estimate of the impact, no chance to read the bill? I've seen a lot in my years here, but this is truly unbelievable. You guys take my breath away. And that's not even considering the already dangerous bill we were supposed to be down here considering right now. Now, let me just make it clear what that bill actually is. First, it is a massive tax cut for millionaires and billionaires, paid for by taking health insurance away from 24 million people, period. Anyone who takes 5 minutes to look at any unbiased analysis of the bill knows that this is true. Massive tax cuts for the well-off at the expense of 24 million people. Now, let me paint a picture of how big that number is. 24 million people is basically the entire population of the country of Australia. It is more people than live in the states of Kansas, New Mexico, Nebraska, West Virginia, Idaho, Hawaii, New Hampshire, Maine, Rhode Island, Montana, Delaware, South Dakota, North Dakota, Alaska, Vermont, Wyoming, and the District of Columbia combined. You know how I know this bill is a tax giveaway for the wealthy and it is not a health care bill? Because according to the nonpartisan Congressional Budget Office analysis, and this is truly incredible, it would actually result in more people being uninsured than if the Affordable Care Act were simply repealed. Let that sink in for a minute. Second, their bill would cause people to pay more in terms of out-of-pocket expenses, and in return they will get lower quality health insurance. That's right, Republicans are asking people to pay more for less coverage. In particular, lower income and older Americans will see their costs skyrocket, those people who can least afford to pay more. Third point, and this is a big one, the bill guts Medicaid and Medicare. Now, don't take it from me. The AARP said, and I quote, This bill would weaken Medicare's fiscal sustainability, dramatically increase health care costs for Americans aged 50 to 64, and put at risk the health care of millions of children and adults with disabilities and poor seniors who depend on the Medicaid program for long-term services and supports and other benefits, end quote. That's the AARP. In fact, Americans aged 50 to 64 will pay premiums 5 times higher than what others pay for health coverage, no matter how healthy they are. This bill is an age tax, plain and simple, and Republicans are cutting $880 billion from Medicaid. That's a 25% cut in funding. All this to give tax cuts to the rich and to corporations. The bill must look like a cruel joke to the most vulnerable among us. Representative Mo Brooks, a member of the Republican conference, said just the other night, and I quote, "Quite frankly, I'm persuaded that this Republican health care bill, long-term, is a detriment to the future of the United States of America," end quote. Finally, even before imposing martial law last night, this process was horrendous. The Republican majority rushed their bill through the committee process without any hearings. None. Zero. Just holding marathon markups where no Democratic amendments were accepted. None. Not one. They didn't even wait for a CBO score. Then, when the score finally came, it showed that the bill would kick 24 million people off their insurance. Did they stop then? No, of course not. Yesterday in the Rules Committee, we rushed ahead with a cobbled-together manager's amendment. I'm sorry, 4 cobbled-together manager's amendments, since the originals had errors, and again, no CBO score on the updated bill. Didn't my colleagues learn their lesson from last week? And even worse, the main manager's amendment, which we received just 36 hours before our meeting, is so full of backroom deals, as I mentioned, like the Buffalo bribe, a cynical, likely unconstitutional agreement with wavering New York Republicans who know the Republican health care plan would devastate New York. And now they're saying, don't worry, if you don't like this bill, it's just step 1 of 3. You'll get another chance to vote on health care during step 3. Never mind that they can't give us the full slate of bills that are part of this mysterious step 3. Or maybe I should just take Republican Senator Cotton's word for it. He said, and I quote, "There is no 3-step plan. That is just political talk. It's just politicians engaging in spin," end quote. Republican Ted Cruz from my colleague's state of Texas called the third prong of this 3-bucket strategy, quote, I quote him, "the sucker's bucket," end quote. The sucker's bucket. That's your own member calling you a sucker if you vote for this. Now, we heard testimony all day yesterday and well into the night about how disastrous this bill would be for hardworking Americans. We heard about how countless major health organizations oppose this plan, from the American Medical Association to American Hospital Association to the National Rural Health Association to the AARP to the American Society of Addiction Medicine to the National Alliance on Mental Illness, and I could go on and on and on and on. This reverse Robin Hood will steal from the working class and give to the wealthy. Under the Republican plan, $2.8 billion, that is billion with a B, in tax breaks will go to the 400 richest families in America each year. Now, my colleagues on the other side of the aisle seem to be rushing this through in hopes that no one will figure out that it's a tax break for the rich masquerading as a health care bill. And now, we find ourselves on the floor debating a martial law rule that will take this reckless process from light speed to warp speed. Now, let me just remind my colleagues again that we're talking about people's lives here. I'm pretty sure the middle-class Americans whom Republicans claim to be helping would be okay with delaying this reckless bill for a little while to give us a chance to find out what the impacts will be. Mr. Speaker, this process is beyond the pale. I'm honestly still stunned that we're even here debating a martial law rule on this legislation of this magnitude when changes to people's basic essential health benefits are being contemplated without so much as a single hearing, let alone a CBO score. And again, we have no real clue what Republicans will be bringing to the floor later today. Now, I'm just going off what I read in the news since we haven't gotten any actual updates from the other side of the aisle. But this rule would allow them to bring anything to the floor today, or tomorrow, or Saturday, or Sunday, or Monday. Literally anything. Will there be a new bill? Who knows? Will it even be on health care? Beats me. What mystery changes are they contemplating that are so broad they can't even narrow their martial law authority down to the topic of health care? Please, please, I would ask my colleagues to slow down. Be thoughtful. This is not a game. You don't get extra points for being fast. This health care repeal affects millions upon millions upon millions of Americans. Don't jam a disastrous bill through the House with patched-up fixes. Wait for a revised CBO score. Listen to what members of your own conference are saying. Or better yet, don't do this at all. Let's go back to the drawing board. It's clear Republicans never really had a plan to replace the Affordable Care Act. Don't pretend you did and then make our most vulnerable pay the consequences. This is a sad day. This is a sad day for this institution. But it is even a sadder day for the American people. I reserve the